first 20% will get better from reading one of the books. The next 60% may read the book, but it's not enough. Why not? Because the things that are going on inside of them are a little bit more important. They are perhaps people who put more pressure on themselves than the first 20%. And remember, I come back to that constantly. The pressure we put on ourselves to be good people, to do things well, to accomplish things and so on, turns out to be more important in this whole business than the pressures that life puts on us. And there's no doubt that they are big too. All right, so the next 60% need what? They need something like working with me. Well, if you live in the New York area, that can be done. But if you live out in Oshkosh, Wisconsin, or in New Mexico or Arizona, it's not possible. I've got a few people scattered across the country who know how to diagnose and treat this disorder, but they're very few. What about the last 20%? Those 20% need to work with somebody like me, and there they really need to do their homework. As you suggested, they've got to work on it. What's the homework? Well, I give them their homework. I give them a sheaf of papers that tells them the things to focus on and to give them some practical suggestions about what to do. Writing, for example, turns out to be so important. It's amazing, and there are even some studies in the literature that indicate how the value of writing can have an influence on psychologically induced things. What about the last 20% now? We've got 80% accounted for. And incidentally, among those who have to work with me, some of them need many, many months. Most of those, however, that need a lot longer time are in the last 20%. They need to spend time working with one of my psychologists, because in their cases, what's going on is even more profound, more difficult, more problematic, and so on, and so they need to work with someone, but they get better.
You did say in your book that there's only about 10 to 20% of the population that is willing to accept psychosomatic or a mind-body disorder as being the causative factor in their illness. Not the symptom, but the causative factor in the illness.
Yes. And of course, that's extremely sad. And there are many reasons for that, which I touch on in the book. Why does the average layman have a problem with this? One thing is that if you have confidence in your doctor, and your doctor says, oh, come on, that's nonsense, that's the end of that. There are other situations in which the emotional things are so strong inside that it's frightening for people to consider that possibility. I think the biggest one, though, is a cultural one. Our culture in the United States is not one that gets involved with emotional things. I mean, I can quote some people in high places, but I won't, who have said, come on, that's a lot of nonsense. I mean, these are people that have an influence on millions and millions of people in the United States. And so the culture does not provide the right atmosphere for people to accept this.
Well, there's a great stigma still attached to being in psychotherapy. Oh, you're having to see a shrink, or you somehow
Sure.
You can't handle your problems yourself. You have to go and talk to someone. That is, for me, I happen to be married to a marriage and family therapist, and so I've kind of been, I'm open to this. I need it to be, because she's the breadwinner right now. But she comes back. There is a statement that you make in your book about psychotherapy and the fact of how important it is in the talk cure, and sometimes it's simply for people just so that they have someone who will listen, and listen non-judgmentally to them, because I find that people are the worst judgers of themselves. They hold themselves to very high standards. They don't allow themselves any kind of gap, or, their mind won't. And yet we all are. We're such a strange mixture, we humans, between our high aspirations and our kind of low venal desires sometimes, that we write this story about ourselves, and sometimes I guess when that split gets to be too wide, I think that that's where psychosomatic illness comes in. Am I off base here, or?
No, you're not, except remember what I said, that this is universal. Okay? In fact, I think it's a good idea not to set these situations or this group of people aside. I think it's terribly important to say that it's part of the human condition to generate feelings in the unconscious mind that may require some sort of physical distraction. That's what mind-body disorders are. As you know, I mentioned in the book something called the symptom imperative, and that is that if you take away a symptom by some artificial means, and that could be a surgical procedure or it could be some kind of medication, and the symptom gets better, then the patient will simply develop something else. And that something else the patient may go from a physical disorder to depression or anxiety or something of that sort. Now here, of course, many psychiatrists, I don't think a lot of psychologists, but many psychiatrists would say, who is this upstart trying to tell us the sources of depression and anxiety? I mean, we have written and thought about that for years and years and years. And my answer is, this is what I have seen. In fact, everything that I've concluded about this whole business is based on what I have seen. There is not one armchair conclusion in any of this.
This is actual hands-on work.
Hands-on work with thousands of patients. At the very beginning, when I began to see a lot of patients with pain disorders, I made the conventional diagnoses and used the conventional treatments, and the results were abysmal. It was only when the idea came to me, because so many people that I was seeing had histories of some of these other things, which I had thought for years, which I had believed for years were related to emotional factors somehow, that is, the stomach things and the headaches and the skin things and so on, the allergies. Then I thought to myself, maybe this is one of those. And when I began to test that theory out, I began to get some good results, and then little by little it became clear that it was one of those, and in fact has become statistically the biggest problem in the United States today. It's not just the back, it's the neck and the shoulders. And we're talking about the top of the shoulder. It's also the shoulder joint, where in my experience, many surgical procedures are done for something that are seen, some abnormality that's seen in there, which is really not the cause of the pain. And again, I say this only because I've taken patients who have these abnormalities, who've been advised to have surgery. And I've examined them and concluded, no, they have the disorder that I've described, and they get better without the surgery.
This is kind of odd, because you came from really traditional medicine.
Oh, yes.
Traditional medicine. And so what was that like, that transition of, was it, I don't want to talk about it, was it a leap of faith, or was it just, when you started applying these theories, and then obviously if the medical community that's been, as you say in your book, for the past 45 to 50 years really been concentrating on, they don't really trust anything that they can't measure.
Yes.
And so to kind of be outside that mainstream.
Well, it's been lonely, for one thing. I don't have the recognition by my colleagues in medicine, even in my own field, which is physical medicine and rehabilitation. That's the field I was trained in. And therefore, it's been quite lonely, but as far as I'm concerned, that's the fate of everybody who comes upon new information.